So the TAPIE toolkit has 5 key principles. They are trust, accessibility, partnership, inclusivity and empowerment.
The toolkit is structured around 4 guides. We have a guide that shares the TAPIE principles, then guides 2 to 4 show how you can apply these before, during and after communicable disease outbreaks. And I think one of the things that we hope will be really useful with this toolkit is that it provides something that is usable at speed during an outbreak, but also gives teams an opportunity to really think about how they can embed these principles in practice before and afterwards to ensure for future outbreaks a more effective and speedy response.
So we started doing this collaborative project together where we were working with different communities in Birmingham and London, exploring their experiences of vaccine communications specifically. And so we did lots of interviews with community residents themselves, so the target audience, the recipients of those communications, community organisations and local authorities to ensure that the communications were accessible and inclusive.
What the Health Protection Research Unit at King's College London gave us was an opportunity to connect with the Health Equity and Inclusion Health team and to start translating those academic findings and getting them really to the right audience. And we had an opportunity to really hone the resource that we were providing to hopefully make it practical and useful for the teams involved in that work.
So we have only just launched the toolkit. So as of earlier this week, we formally launched the toolkit. It has its place on the UK government website, and we are inviting practitioners to give us feedback on how they found using the toolkit in practice.
One of the massive benefits of working with academic partners on this project is it allowed a group of people who could look at things really neutrally. They were able to pull in experience and ideas from across the system, so from local authorities, NHS, UK Health Security Agency and others, as well as communities, to really kind of take a whole system approach. It was particularly helpful as well because it helped us to sense check what we were doing and make sure that it was actually as valuable as we hoped it would be, and really kind of essentially give us a bit of a critical friend throughout the approach. And I think we're starting to get some really good interest from different practitioners, so keen for training and workshops to look at how to apply it within their context. So we're hoping that we can kind of take that forward and then possibly evaluate it over time as well.